In this video, I'll be going through some of the issues with MDMA-assisted therapy at this time in Australia and try to shed light on some of the pros and cons of pursuing this approach. If you're interested in learning more about MDMA and the situation in Australia, stay tuned till the end and I'll do my best to give you a balanced perspective on what's happening in Australia at the moment with MDMA. It's really important not to get swept up by the headlines. There's a lot of misinformation about the use of MDMA. I'm a registered occupational therapist and I've been working in mental health for over 20 years and 10 years as a group therapist in a hospital environment. 10 years ago, not many people would have brought up the topic of psychedelics in therapy at all. But in the last 5 years, there's been a significant amount of interest in MDMA, psilocybin, and other psychedelics in mental health treatment. One of the problems in mental health is there's no one size fits all, and some approaches don't work for certain people, particularly with difficult conditions like PTSD and depression. So for many years, people have held hope that these treatments might have something promising for people that are struggling with their mental health. In 2023, the TGA reclassified MDMA from a Schedule 9 to a Schedule 8 drug. A Schedule 9 drug is completely prohibited, whereas Schedule 8 allows it to be used for controlled, legal medical use only. But here's a crucial detail. It's not a free-for-all. Only authorised psychiatrists who've completed specific training can prescribe MDMA, and only for PTSD under strict clinical protocols. That means you can't just walk into a clinic and ask for MDMA therapy. It is highly regulated and closely monitored. Firstly, people that want to access this treatment have to have a PTSD diagnosis. Second, you need to find one of the psychiatrists in Australia who is already an authorised prescriber. This rigorous program is managed by the TGA, and doctors have to submit a lot of documentation, and it also needs to go through an ethics committee in order to fulfil the criteria for them to be an authorised prescriber. And then there's an extensive screening process to see if people might be suitable for the treatment. One of the big differences with treatment with MDMA and psilocybin is that it's not just the drug. The protocol for MDMA, which was developed by MAPS, is almost like a hybrid. It's a combination of psychotherapy as well as the drug itself. And this protocol is actually a fairly involved process, and it means that you can't do one without the other. And that process at the moment is very much following the MAPS model, which was used in clinical trials. It's very far from recreational use. And there's not a lot of discretion in terms of the dosages. At the moment, the dosage is a fairly fixed protocol, and doctors have very little flexibility around changing that dosing. The clinical reality of taking MDMA therapy outside of clinical trials and implementing those in clinical services is a really big deal. It has a big impact on services because not only is it a legal shift, but it also recognises the failure of so many treatments, particularly for PTSD and depression. Over a decade, I've worked with so many people with PTSD that don't seem to get to a point of their own recovery, and they're still struggling many years later. So we need other tricks and solutions for treatment for people with long-term mental health conditions. The best research that we have is from MAPS, and that was published in the journal Nature, which found that PTSD criteria reduced significantly, and some people had a massive diminishing of symptoms. 67% of participants no longer met the criteria for PTSD in their study. That's unprecedented, especially for people that haven't responded to other treatments. Although it's pretty important in real-world scenarios that we take into account that there are many complicating factors and many factors that can't be controlled outside of clinical trials. So real-world application of this treatment still needs a lot of data collection to be able to establish whether it is in fact an effective treatment. There's another reality that one has to consider with this treatment, and that is its huge expense. I can't put an exact figure on it, but it's potentially in the tens of thousands to access this treatment. Over a period of time, there are 3 dosing days which potentially go for 8 to 12 hours. And those sessions involve two therapists at once. At the same time, a psychiatrist needs to be on site to be able to respond if there's any emergencies that come up. So just that alone means that you've got 3 resources on one person for an entire day at this time. It's not a particularly sustainable or affordable model for a lot of people to access treatment. And it would put it as being one of the most expensive psychiatric treatments that we have at the moment. Sometimes it's a question of whether people have actually done other evidence-based treatments to their full. I find that a lot of people that would come and do therapy have not necessarily had good quality treatment, and MDMA is not covered by Medicare at this point whatsoever. So there's no subsidy. At the time of recording, one of the major health funds in Australia had started subsidising this treatment when done in hospital. As more psychiatrists complete the training and we have more real-world data, the access to this treatment might increase. If you or someone you know is dealing with complex PTSD or treatment-resistant PTSD, a decision to take MDMA or participate in MDMA-assisted therapy is a big decision, not only because of its cost, but also we don't have enough data in real-world studies to know whether this treatment is in fact the best option that we have at the moment and whether it will stand the test of time. There's been a lot of interest in it over many years, and personally I think it's very promising, but I think it needs to be taken into account that there are pros and cons to all treatment, and it's not an easy decision, and it's certainly not a panacea. What questions do you have about psychedelic assisted therapy? Drop them in the comments below. I'll try and respond to every single one. If you want more evidence-based mental health information, hit subscribe and the notification bell, and I'll try and keep you updated with some of the most important clinical issues I can cover.